Good morning, everyone. Can you hear me? Can you hear me? Test, 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 test. Yes. First, we want to thank you for your patience. We got a bunch of students who are still en route. Buses are what they are, as all of you know, and traffic is what it is. So we've got about three buses full that are yet to arrive and are imminent or are in the process of unloading. So we'll have people coming in and out over the next 30 minutes or so. But you're here, and we want to welcome you to Esperanza. My name is Reverend Danny Cortez. I'm an executive vice president and chief of staff, chief of operations, depends what day it is and who's in front of me. But the official title is chief of operations, and that basically means it's my responsibility to oversee the affairs of the entire organization of Esperanza. Um, This program that we're having here is created by Nilsa Graciani, Dr. Graciani, who's over here. And it was her brainchild and her creation. And Nilsa, how many we had the first year, right? And today we're pushing, so that's 360 kids, young men and women from our neighborhoods who will be coming here to be exposed to the speakers and to the possibilities. So I want to thank Nilsa and Marilyn, who is the executive dean of the college. I'll be talking to you in a little bit. I want to thank her as well for the excellent work that they do. I wanted to tell you why we exist. Why is that Esperanza's here? I grew up in the city. I went to public schools. I think I had a 10th grade reading level when I graduated from high school, and nobody thought I would go to college and succeed. And when I talked to my guidance counselor about going to college, he wanted to discourage me and tell me to apply to lower grade schools. But in the end, um, I was a church kid, and people in my church believed that I had what it took to succeed. And they encouraged me, and they made sure that I took advantage of every opportunity that existed, and I absorbed what I could so that I would have a better tomorrow. Why does Esperanza exist? To make that story true for everyone that walks through our doors. We have about 650 people working here, and our job is to create for them transformative moments, what we call opportunities. Our whole philosophy is opportunity creation that produce transformative moments to change the lives of the people God has called us to serve. Now, we also run non-sectarian institutions, so sometimes the religious language isn't as present, but that's what motivated us to create the entire organization. And we do that through K to 12 schools. We got a cyber school with 1,000 students who are out competing neighborhood schools. We have a K to 5, K to 12 on-ground academy with 16 and 1,635 kids who are doing real well. Our entire reason for existence is to create pathways, gateways, right? Avenues that will allow all of you and anyone who walks through our doors, right, an opportunity to improve their lives. We do this via programs, but we also do it with ideas. And this is a classic example of a program that produces ideas. So Nosa created this program, but why did she create this program? Because she believes that we produce talented young men and women who can go out and make a difference in the world. She believes that in our schools, K through 12, anywhere, there are young men and women that have what it takes to stand on this stage tomorrow, to become the future doctors, engineers, lawyers. And we understand that one way to help that vision, that possibility, that idea, right, be a reality for you is to show you that that's a true story, because the people who stand in front of you are from the hood, are from communities of color, have experienced what many of you experience every day, have gone to the types of schools that we go to, and yet they're the tops in their field. Amen to that. Well, I forget I'm not in church. But the point is, in this room and on that screen, wherever it is they're in this building listening, because we have an overflow crowd, even though we got a few seats here, but There are young men and women that our goal for today is that we plant an idea in your brain and in your heart. And that idea is this: I know I can be that doctor. I know I could be that lawyer. I know I could be that chemist. I know I could be that biochemist. I know I could be that engineer. We want you to aspire to something larger. We want to put in your brain the possibility that if you apply yourself and you take advantage of the opportunities afforded, you also can stand on the stage. And I believe that with my whole heart. Less than the 10th grade reading level, told I wouldn't succeed, and today I manage a $70 million corporation with $120 million in assets and 650 employees. Why? Because people gave me opportunities, they opened doors, they encouraged me. This program is about encouraging and opening doors. So we want to thank you for being here. We thank you because ultimately the reason for our existence is to make these kinds of things possible. So Nelson, muchas gracias for creating this experience that we hope will plant ideas, that will be opportunity creation and transformative moments, hope, which is what Esperanza means, right, for young men and women of today. So thank you for being here. Welcome to Esperanza. Everything you're going to see in this building and across the street, this entire campus, let's change lives. Let's create opportunities. God bless you and thanks for being here.
Thank you, Reverend Danny. My name is Marilyn Marsh, and as he mentioned, I'm the Dean of Esperanza College, and I'd like to welcome you as well. Good morning. I hope you're wide awake today. It's Friday the 13th, but it's going to be a fabulous Friday for you. I want to say good morning to future researchers, future doctors, future nurses, future technologists, future educators, doctoral students, teachers. That's who you are. And that's why we're here with you today. This program has been going on for a few years simply to broaden your exposure to opportunities that are available to you. If you don't know it exists, you can't dream it, can you? If your vision is limited to, I can only be a nurse or I can only be a doctor in the health science field, that's all you can aspire to. But after today, after our guest speakers and our panelists, you'll know of so many other career opportunities that are available to you. And I'd like to thank your chaperones, your teachers, whoever came with you and made today possible, because they didn't have to do it. And Dr. Graziani, thank you for making this an opportunity to students from whatever school would like to attend, because it's important. Our guest speakers, our panelists, our supporting corporations, our college staff is here. They've been here preparing for you. We have volunteers from other departments. We have students here preparing for your day. Why? Because we all agree on one thing. Your future is valuable. And you have an opportunity to do something important and play an important role in this world. And we want to contribute to that in any way that we can. So listen carefully today. Enjoy what you're hearing. Not only listen to the types of positions, but listen to their pathway. Because sometimes we think we can't get there, like Reverend Danny said, or others tell us we can't do it. But we're here all today, and you could look at every person here who's involved in this session. We're here so that if no one else tells you, you can do it. You heard at Esperanza College, you can do it. If you can dream it, if you can imagine a goal, you can do it. That's why we're here. spending our time investing in you. You're going to have an awesome day here. You'll be upstairs in the college. There are a lot of activities that are waiting for you. You're going to enjoy it. We have lunch for you as well. I hope you'll enjoy this day, and I hope you'll never forget that there are people here today that told you that you have hope, you have a future, and that there are opportunities available to you. I don't care where you came from, what your background is, and what others have told you. There is opportunity waiting for you. And if we can help you in that pathway, we will be here to help you. Esperanza College is a branch location of Eastern University. We provide associate degrees in a number of programs here. Most importantly, our students get a private, faith-based education right here in North Philly. Every student who enters our door gets 50% off of their tuition. So basically, our students get a private, faith-based education and have minimal amounts that they are responsible for after federal and state grants. I hope we can be a part of your pathway to success for some of you. So thank you and welcome again. Enjoy your day. You'll have a great day today.
Good morning, everyone. Thank you for being here. I know some of you are just coming in. We're going to move forward with our speakers. Our first speaker this morning is Dr. Cynthia Marie Nieves. She is a nurse with a doctoral degree in nursing from Temple University College of Public Health, where she completed a family nurse practitioner program as well as a certificate in teaching higher education. She is born and raised in Philadelphia. Dr. Nieves attended Thomas Edison High School. So again, we just talked about this. So right here in the community. Her academic trajectory included an associate's degree from the Community College of Philadelphia in Culture, Science, and Technology, then a diploma in nursing from the Abington Memorial Hospital Dixon School of Nursing, and then a bachelor's of science in nursing from Penn State University before pursuing her doctoral degree. She is currently a director of nursing for Comar, as well as a nursing supervisor for both Temple Health and at Episcopal Hospital and Jefferson Health at Abington Hospital. She volunteers with the American Red Cross as a member of the Awards and Scholarships Committee. So let's welcome Dr. Nieves.
Thank you. Thank you so much. Hello, good morning, everyone. Can everyone hear me well? Great, great, great. How is everyone? Good to hear. Perfect. Well, I'm excited to be here today, and I am glad that you're all here. I thank Esperanza College for the privilege to be here with you today. Today, I'm going to be presenting on hypertension, which is high blood pressure. But before I do, I'm going to share with you information about my nursing career as well as nursing. As introduced by Nilsa, my name is Cynthia Marie Nieves, and I'm a nurse. I love being a nurse. I am happy with my career choice, and I genuinely enjoy caring for others and working in healthcare. Um, okay. I know that Nilsa actually just introduced all of this. I had to put this in my slides. I have a few jobs. I'm a director of nursing with Comar. Comar is a Philadelphia-based mental health services organization. They provide a wide range of mental health services for adults, children, and families. Many may know their services as outpatient services, where you can seek therapy or psychiatry services. They provide services in Philadelphia, Montgomery County, Northampton counties. Um, with Comar, I am responsible for the nursing services provided throughout the entire organization. This includes trainings that the nurses receive, the care they provide, as well as I create policies and procedures. Um, I also work for Jefferson Health. I'm a nursing supervisor for Abington Hospital. And at Abington Hospital, when I am on duty, I'm responsible for any incidents, issues, hospital needs that arise, as well as I assist in medical emergencies. I also work with Temple Health. I also work with Temple Health as a nursing supervisor, but at their Episcopal Hospital campus. It's a little bit different than Abington Hospital. They have an acute psychiatric facility, they have an emergency room, as well as a crisis response center. And so anyone who is experiencing a mental health crisis can seek care 24/7, so it never closes. So anyone experiencing any mental health issues can get help there. I volunteer. Despite my three jobs, I volunteer with the American Red Cross. The American Red Cross is very near and dear to me. I've been with them for 8 years. My current role with them is serving on the Awards and Scholarship Committee. Um, I was actually appointed to this role by the Chief Nursing Officer of the American Red Cross. And what I do is um, I get to review scholarship applications and I get a vote. I get a vote in deciding who should get those awards, who should get those scholarships. And we have national and international scholarships. They're normally awarded to volunteers. And volunteers, let's see, you can start volunteering with the American Red Cross as early as the age of, I think, 16, 17 years old. Um, my education, as Nilsa in her introduction, she shared with you, I have a Doctor of Nursing degree, which is a DMP. I just got this 2 years ago from Temple University. So I'm sharing that with you because learning is a lifelong process. And I decided I wanted to go back to school and I wanted another degree. And so I earned a Doctor of Nursing degree from Temple University, which was a family nurse practitioner program. I also have a Bachelor's of Science in Nursing. That's from Penn State University. I went to their Abington campus, which is just about 15, 20 minutes from here. I have a diploma in nursing. And that program allowed me to sit for my state boards. That's what allowed me to become a registered nurse. And I got that from a program called the Abington Memorial Hospital Dixon School of Nursing, which you may know it today as Jefferson School of Nursing in Willow Grove. But it all started for me here, right here in Philadelphia, Community College of Philadelphia, CCP. At CCP, I earned an associate's degree in culture science and technology, and that's sort of the equivalent of what Esperanza provides now in their health sciences program. And that is what provided me with the foundational courses that I needed to be able to transfer to something else in the health sciences, and I chose nursing. This slide right here is This slide right here, it highlights nursing levels and degrees because there are levels in nursing. If you look on the left-hand side, when it talks about levels in nursing, you have nursing assistants, licensed practical nurses, registered nurses, advanced practice nurses, such as nurse practitioners, nurse midwives, nurse specialists. And you can specialize in a lot of things. You can be a nurse and specialize to work in the operating room. You can be a nurse you can specialize to work in cardiology. You can also be a certified nurse anesthetist. And those nurses, they actually work in the operating room and they give anesthesia to patients. Degrees. The right-hand side lists the various nursing degrees that there are. So you have diploma in nursing, you have associate's degrees, bachelor's of science in nursing, which you may hear of it as a BSN program. And generally today, that's what most employers are looking for nurses to have a BSN at entry level. You can advance your education with master's degrees, doctorate's degrees, and there are two different kinds of doctorate's degrees. So if you ever look at them and you wonder, well, what's the difference between these two? You have the Doctor of Nursing Practice, which is more clinical, meaning you will work with patients one-on-one. You can see patients on your own. You can assess them, diagnose them, prescribe medications and things of that nature. I work in a doctor's office with doctors. A Doctor of Philosophy in Nursing with a PhD, that's more research oriented. So people who are interested in research, right? Finding out, there's so many things you can do in research, right? Like researching how medications work once patients take them or outcomes and things like that. So there's a ton that can be done in nursing. This slide right here, this is an educational pathways in nursing. And the reason why I show this slide, right, is because I think that if you're new to nursing, you may be wondering, well, what's the difference between this and what's the difference between that? Or what do I need to get to this next level? And this, I actually copied it as well at the end for any students who may be interested in having a copy of this slide, because it shows you everything that you need to advance to the next level of nursing. So if you want to get a master's, what do you need before you get a master's? If you want to get a doctorate, what do you need before that? If you want to start off as a nurse and just get started as an entry-level nurse, what are those things that you need? And this is an educational pathway in nursing, and it clearly outlines everything from a practical nursing program all the way up to the PhD level. Nursing salary. Now, I know you're wondering, well, how much do nurses get paid? Well, that's an important question, right? Especially if this is going to be a career goal for you. I looked at what the literature said. I looked at actually some current stuff. According to the Bureau of Labor Statistics, a new nurse hourly makes about $38 to $40 an hour. And that sounds about right for a new nurse entry level. That's starting $38 an hour, which is about $80,000 a year. You start off there. Every year that you're in nursing, you are eligible for more, or the more years you have in nursing, the more you get paid. So this has you at the high 30s. It goes up to the 40s, the 50s, and the 60s dollars an hour. Now, remember just a few slides ago, I talked about the nurse anesthetist right here, the one who puts people to sleep, anesthesia. That is the highest paying nurse that there is. They make 2 to 3 times this. They make just as much, if not more, than a doctor. So if you're ever wondering what nurses make, this is it. Where can you go with nursing? What can you do in nursing? Some people want to be nurses and they say, you know what, I want to be a nurse, but I can't see blood or I can't see things like this, but I really want to be a nurse. You can still be a nurse and not have to do those things. You can work in a wide variety of places. So I'm going to forward, but I'm going to go back to this slide. I was like Googling, what things can you do? What things can you work? Where can you work in nursing? There's over 150 jobs on here. I counted them. I looked at all of them. They're all real jobs. And there's way more than this because there's still things that I could have thought of that are not on this list. So here there are over 150 jobs that you can do as a nurse. I also have this slide that we can print out for anyone who wants it. If you want to look at it and see what kind of nurse can I be? Where can I work? If you want to be a nurse, there's a place for you in nursing. So we're going to go back here. Where can nursing take you? You can work in a hospital. You can work in a clinic. You can work in an operating room. You can be an OR nurse. You can work in oncology, which is a specialty of cancer. Nurses are trained to provide chemotherapy, so you can work in a cancer unit or hospital with patients with cancer. You can work in pediatrics, children's, babies, newborn babies. Mental health. Mental health services is very important. There's mental health nursing. I'm also a mental health nurse. Emergency room. If you're interested in high-paced emergency room environments, working in a trauma bay, there are a lot of great emergency rooms in Philadelphia. Public health nursing. So public health nurses, they work with the public, right? They work with education and prevention, and it can be something as simple as teaching people about vaccines. But in the past 3 years, they really have had their work cut out for them with the pandemic. Those are the nurses who were out there providing vaccinations, providing education. So that's public health nursing. Informatics. Informatics is also another big area in nursing. It's really taking off in healthcare in general. Does anybody have any ideas on what an informatics nurse can do or what informatics is in nursing or healthcare? Well, it's generally working with computers and technology, and it can be a variety of things, right? So maybe for those nurses who don't want to, see the blood or see certain things or be clinical at the bedside, there are things that you can do. You can monitor patients virtually. There are people at home who are on oxygen measuring machines, who need their vital signs taken, who need their weights taken every day to assess their cardiac health. And you can monitor that virtually. EKGs, you can do cardiac monitoring virtually for patients. By a show of hands, are there any gamers in here? Virtual reality lovers, gamers. There has to be somebody in here interested in gaming. Virtual reality, gaming, virtual reality. Awesome. Computers. Anybody interested in computers, IT? I see people pointing at each other. It's okay. Raise your hand. Gamers, computers, IT, virtual reality. Or, well, guess what? There's a place for you in healthcare. There's a place for you in health. More hands. Virtual reality. Well, guess what? You can also work in health sciences, and I'm going to show you how. Virtual reality is changing the world of healthcare. So if you look at these two pictures, right? The top, the top one, these patients, they're doing physical rehab, right? But they're using virtual reality. Maybe the Oculus, maybe, I'm not sure. Yeah, Oculus. Oculus is doing a really big thing in healthcare now. So this is helping them with physical rehab. And I don't know why they're in rehab, right? It could have been because of an injury or a stroke. But what this is doing is, when you're in the VR reality, right, you're more motivated to do things. And physical therapy, this is helping them to make movements to, get those arms and legs moving. The second picture, the bottom part, you see someone's hand there with those three screens? Well, this is an actual photo of a patient with severe hand burns, right? And so they have deformities, they have contractures, they aren't able to move their hands very well. But here they're using virtual reality to get them moving. And you can see, I'm not sure if you see well, but the three different videos, it's having them do arm movements, right? Like one looks like a fishing rod, and it's having the patient move their arm like this. So there's three different kinds, and what it's doing is it's giving this person physical therapy by using virtual reality. And sometimes that's even a bigger motivation than just doing regular physical therapy without the virtual reality. I have a video here. This is about virtual reality in healthcare. Now, this specific video, this is actually showing virtual reality being used for patients with spinal cord injuries who are paralyzed from the neck down. If I can get this to play, IT. IT assistance. I hit play. Mhm. So in virtual reality for persons, they're using virtual reality for a wide variety of things, right? So they're trying to stimulate nerves and limbs of those who are paralyzed. Someone's moving it. Magnify it, maybe. If not, that's okay. Volume. All right, somebody's working on it in the background, guys. All right. Volume. All right. Well, I have a few videos. Well, if we can't get it to play, we can move forward. We'll give it one more try. Even without the volume, this person is paralyzed. They're in a wheelchair. They're using virtual reality in an attempt to stimulate them and assist them in their rehabilitation process. We can move forward to there's actually a video coming up next that I really want you guys to see, because virtual reality is not only the next big thing in healthcare for patients, but it's also the next big thing for us, for me, you, as students. It's the next big thing for doctors and nurses and teaching them, right? So virtual reality and this metaverse thing is assisting with trainings and surgeries and brain scans and things like that. It's also helping in schools, right? Nursing schools. It's helping medical students, especially with anatomy and physiology. And right now, Esperanza actually has virtual reality. I know that there is some sort of virtual dissection table that the school has, which is really cool. I actually taught at Esperanza last year, and I think before I even started, I was like, can I see the table? Can I see how it works? It was really one of the coolest things I've ever seen. Back in my day, those things didn't exist, but Esperanza has it. Um, I think we can move forward. They're trying. I see them up there trying. Next video. Can we try for this one? This is a really cool video. This is actual real life. You can see a surgeon's meeting. You can see how medical students are using virtual reality. So this doctor, he's actually a surgeon and he's consulting with other surgeons in other states and other countries. They're actually consulting on a brain surgery and they invite the journalist in so that he can see. So apparently you can like stick your hand into this brain and turn it and look at different parts of the brain. And all those heads are other doctors who are like in other countries, but they're joining in on this virtual reality meeting. I'm going to let it play, guys. I know that it's silent, but one of the really important things is you're going to see students looking at a skeleton, right? And it's showing all the anatomy and the physiology. And the students say, wow, with, there's the volume. Um, with this virtual reality, they probably wouldn't have known that the things lie the way they do in the human body. So this is the skeleton right here. Somebody is looking at all of the spinal nerves and where they're located at within the body. So we can move forward if we happen to get the volume later, and if you're interested, we can go back and play it. They're not long videos at all. And now they've taken. Okay. All right. So we are in a Minorities in Health Sciences Symposium. We need you. Um, we need you. We're here because we want to attract you into the health sciences. And why? Great careers, good paying careers. The salary is good, but by joining the health sciences, you make a positive impact on the health outcomes of others, especially minorities. Um, when you join the health sciences, whether you're at a nursing level, a doctoral level, an informatics level, you strengthen the quality of healthcare. You can relate to patients. You understand their backgrounds, their perspectives, and their life experiences. They're more likely to open up to you and tell you what they're going through, what kinds of treatments they've done at home in order to alleviate whatever it is that they're going through. It increases the trust level and comfort of the patients that we see. And it gives them feelings that their values and beliefs are being respected. Um, and it also provides cultural competence. Cultural competency is really important, and if you haven't heard about it now, you're definitely going to hear about it in the future. Cultural competence is understanding the values and the cultures of different persons and respecting it and giving them the care that they need while being culturally competent and respecting that this is how they may react to certain health conditions or this is what they do to treat their certain health conditions. And you're still going to take care of them. You're still going to provide them the care that they need, and respect their decisions and their beliefs. That you don't compromise their beliefs, and all of this, it means that they're going to have improved health outcomes. You're going to have healthier lives, healthier communities, healthier families when we introduce more minorities into healthcare. And that's one of the big reasons why we're here today in this symposium. So I say to you, whatever your career choice, whether you want to be a nurse, a doctor, a lawyer, a president of the United States, not only do I wish you all the best, but I need you to know that you matter. Your journey counts. Everyone here counts. Everyone has a unique journey. There's a whole wide world out there waiting for you to go out there and conquer it. Whether you decide to go to college in another state or another country, you really are the future of this world. And I know that, things aren't always easy, right? It may be easy for me to say, easy for me to speak, but it's not always that easy in real life. I know that you face pressures outside of school. And I know because I've witnessed them firsthand. When Nelsa introduced me, she told you I am from Philadelphia. I am. I'm North Philly, born and raised. I was raised in poverty. I know what it's like to see violence and drugs in the neighborhood. I know what it's like to feel that peer pressure, right? And it wasn't easy. Well, what I did was I took that and I used it as my motivation to advance my education. And on my third slide in my introduction, I think I laid out all my educational accomplishments really nice and neat on a slide, right? Really nice and colorful. But that wasn't how it was in real life, right? That wasn't that perfect or easy or, laid out like that. In real life, I had to catch the bus to a train, the train to another bus, and still walk to get to work or school. Um, it took me more than 2 years to finish Community College of Philadelphia. That's a 2-year program. It took me way longer than that to finish. Why? I had to work. I had a family I had to take care of. So what I did was I worked my way up. Before I was a nurse, I was a nursing assistant. I went to a medical assistant program. I took a class here, I took a class there at CCP, wherever I could, whenever I could squeeze a class in. And then one day I finally said, you know what, I got to go for it. I got to jump into this nursing program. Um, there was a time that I thought I couldn't go to college, that I couldn't do it, I wouldn't do it, I couldn't afford it, or that I wasn't going to get in. But you know what? Don't think like that. You can do anything and be anything you want to be. You can go to school nationally or internationally if you choose, or you can go locally. Right now, you have Esperanza right here at your doorsteps, offering you the very beginning steps into a rewarding career. Not only that, you're in a major educational hub. So, for those of you who don't know, Philadelphia is home to colleges known worldwide. People come from all over the world to come to the schools that we have here in Philadelphia. So, just to name a few, we have Temple University, we have Jefferson College, we have Drexel University, we have one of the best Ivy League schools right here in West Philly, University of Penn. You can get to all of these on the 47, on the L train, on the Broad Street line. So whatever you decide, you have to know that no matter what, you count, you are important, and that you're going to impact the world. Believe that. Okay? Now, that's that for the nursing part of the presentation. I do have to also present on high blood pressure. So what is blood pressure? Is anyone familiar with what blood pressure is or high blood pressure? Anyone? So blood pressure is the pressure of blood pressing against the walls of your arteries. And the arteries, what they do is they carry blood from your heart to other parts of your body. And I had a video next, IT. Can we play this video? I think that the video explains blood pressure way better than this definition. You can actually see. Video? No? Oh, we can't play the video. Gosh. Well, you know what? If anyone is interested in any of these, we can email it out to everyone because this video really sums it up. It's less than a minute, but it gives you a great animation of what blood pressure is, what is high blood pressure, and why it's bad for you. So, high blood pressure, the formal name is hypertension. It's blood pressure that's higher than normal. Our normal blood pressure range is about 120 to 80. If you have high blood pressure, if you know anyone who has high blood pressure, it's so important that they take their medications exactly as prescribed. Because if not, high blood pressure can lead to a lot of other consequences. Here in the slide, you see from the American Heart Association that when people have high blood pressure and if it's not treated well, if it's not controlled well, it can lead to stroke, heart failure, heart attack, vision loss, right? Injury to your optic nerves, kidney disease and failure, And so these are all consequences of high blood pressure. And actually, 1 in 3 adults in Philadelphia has high blood pressure. That's a high number. 1 in 3. So everybody you look at, count 1 in 3 has high blood pressure. What are the risk factors for high blood pressure? How do you get it, right? Sometimes it can be genetic, sometimes it's not. Um, Persons with diets high in sodium, which is salt, low in fruits and vegetables, can be at risk of getting high blood pressure. Smoking, drinking, low levels of physical activity or obesity. And there are things that we can't change. Our age, our gender, our ethnicity places us also at risk of high blood pressure. And women also tend to get high blood pressure more than men. How do you prevent it? Well, you change the things that you can change, all those things that put you at risk on the previous slide. You change those things. So you try to live a healthy lifestyle. You try to get enough sleep. You try to eat a healthy diet with high in fruits and vegetables, low in sodium, which is salt. And a big part of that is learning how to read the backs of the food labels, right? Because sometimes you see the back of the food label and it'll say um, 200 milligrams of sodium. But that's like per teaspoon, and a teaspoon is like this tiny. And how much are you really pouring into the food? Um, Not smoking, avoiding alcohol, maintaining healthy weights, and being physically active. Those are all the recommendations to prevent high blood pressure, or if you do have high blood pressure, to do these things to keep it under control. You all can make a positive impact on reducing high blood pressure. You're probably wondering how. Well, I just explained some of the things that you can do. So, what you've learned here today, you can teach others. If you have family members who have high blood pressure, friends, loved ones, people who may not be taking it serious because you don't really feel high blood pressure, right? But with what you've learned today, you can teach others. You can make changes in your own life, right? Because this is something that you can prevent. So from the time that you're perhaps, I think it's 3 years old, when you start going to the doctors, they check your blood pressure at every visit. And that's what they're checking for, to make sure that you don't have high blood pressure, because it leads to all these other things. So just maintaining a healthy lifestyle can help prevent this. So help others to make the changes and be an advocate. That's how you can help, and that's how you can make an impact. And that's it for my presentation. Thank you, everyone. Thank you for your time. All of the following the following slides, these are not for review, but these are things that I added. If anyone is really interested in nursing or just wondering anything about nursing, I added all those slides, right? So it tells you for every degree what it is, what it means, right here, all of those 150 plus jobs that you could do if you wanted to be a nurse. Also, another stereotype is that nursing is for women only. No, nope, not women only. The educational pathways in nursing. So we can give that to everyone. Thank you, everyone.
So you heard about the Anatomash virtual dissection table. Everyone will have a chance to use that later on today, as well as we do have some VR goggles. We have them set up for a chemistry activity. We do use them for anatomy and physiology as well, but today you'll be doing some chemistry stuff with them. But it is really cool how virtual reality is making such a big difference in healthcare. So our next speaker is Michelle Davis. And Michelle is a second-year medical student at Drexel University College of Medicine. She's a native New Yorker, receiving her Bachelor's of Science in Biology from St. Joseph's University in New York, a Master of Public Health from SUNY Health Sciences University, and a Master of Biomedical Science from Drexel University's Pathway to Medical School program. She is passionate about orthopedic surgery and was a 2023 Nth Dimensions Scholar at Mayo Clinic, where she investigated the incidence and factors associated with hardware removal status post tibial tubercle osteotomy. So, of course, these are big words, but today you'll learn a lot about orthopedics from Michelle. She currently serves as the co-president of the Orthopedic Surgery Interest Group, the Drexel's Black Doctors Network, and the Student National Medical Association. Her non-traditional path into medicine fuels her passion for mentorship and increasing diversity in medicine. She encourages diversity and inclusion efforts through her mentorship roles in Drexel University's Pathway to Medical School program and as a peer mentor for first year medical students. Again, that's something that's always very important. Michelle, welcome.
Wow. Okay. All right. Thank you, Dr. Graciani, and thank you everyone for having me here today. So we're going to talk about pediatric bone diseases associated with obesity. But before we start, I love The Office, and I don't know if you guys have seen The Office because y'all a little young, but um, Michael Scott said you miss 100% of the shots that you don't take. Wayne Gretzky, Michael Scott, and now Michelle Davis. So like Dr. Graciani said, like I have a non-traditional path. I pretty much always wanted to be a doctor since I was about 6 years old. No one in my family is a doctor, so it was pretty much just a learning curve for all of us. I'm so glad that I have them and like I can literally just be able to do this and have their support because it's actually really hard. And not knowing like what to do and like where to go and things like that, like, and just basically navigating everything on your own is like just in and of itself like a challenge. So when I went to college, actually, my senior year, before you graduate, you have to speak with your advisor about just post graduation plans. And when I spoke to my advisor at the time, she was just like, well, you know, you didn't have this, you didn't have that, you didn't do this, you didn't do that. And she was like, you won't be a doctor. You probably should find another career. And I just said, thank you. And I left because I wasn't going to listen to her. I was going to shoot my shot. And along the way, like I got my master's in public health. I worked for a bit. And then I still felt like I wasn't being fulfilled. And I took the MCAT, unfortunately, which is the medical college admissions test. I took it 5 times. Um, but I knew that I wanted to be a doctor. And what I'm saying to you is that always shoot your shot. Like, you'll never, ever know if you'll be able to do it if you don't take your shot. So, yeah. And then now I'm here today. I'm speaking to you, and I'm a second year medical student. So, thank you. So, to my advisor, she was wrong, but we move. So, just an overview of what we'll talk about today. We'll talk about some bones, obesity and your bones, Blount's disease, and Skiffies. And then you guys will be the medical students, and you'll tell me the diagnosis. So, let's talk about bones. So, your bones produce red blood cells and white blood cells in something called a hematopoietic compartment. All of your bones are made of minerals, which are calcium, phosphorus, sodium, and there are 206 bones in the body. Your longest bone is your femur, which is in your thigh, and your smallest bone is in your stapes. It's your stapes. Does anyone know where your stapes is? It's in your ear. Okay, so since today's talk is about weight and how it can affect your lower limb, we're going to go over some anatomy of the lower limb. This is actually from my notes from last year too, so. All right, so can we, that's it. All right, so your lower limb is basically broken down into 4 different areas. So we have the hip up here at the top, which is 3 bones. It's the ilium, ischium, and the pubis, but you can't really differentiate in this picture. But the next part is your thigh or your femur, the femoral region. And then your leg, which is your tibia and your fibula. And then we have our foot. So now an x-ray is pretty much the same thing, right? So we see the femur here, and we see the tibia and the fibula on the side as well. So very straightforward and easy to follow. All right. So now we have a pediatric x-ray. So compared to the last slide, it's the same bones, right? We see the same types of bones, but what's different? So you see here how there's a little gap. That's actually your growth plate or your epiphyseal plate. And this is on the left-hand side is a 2-year-old, and on the right side is a 7-year-old. So you see the gap is closing as you're getting older. So bone grows by a process called ossification, and there's 2 types. It's intramembranous, which are your facial bones, and then endochondral is the rest of the bones of your body go through that process. So throughout adolescence, your bone grows in length and width, and it's through a process called bone remodeling. So with that being said, it happens with osteoclast and osteoblast. Osteoblast, B for building, so it builds the bone, and osteoclast, chew or cut off the bone. So how does obesity affect your bones? So it's pretty much a domino effect, right? So as we gain weight, we have to support the weight that we're holding. So when you gain weight, you're going to increase your bone mass to support that weight, which would then lead to things like early arthritis, so swelling of your joints, inflammation of your joints, and then fractures from falls, and also fractures. So one of the diseases that we're going to be talking about today is called Blount's disease. And the Latin term is genu varum, which is bow leg. And as we see here in the picture, it's actually a juvenile. But they're broken down, the classification is broken down into 3 different types. So we have infantile, juvenile, and adolescent. And adolescent is one of the least common classifications, and it's usually unilateral, and it's caused by obesity. So some risk factors for Blount's disease is obesity, early walkers before the age of 1 year old, and also race and ethnicity. So it affects our Black and Hispanic communities. So what are the treatment options? So for infants, you can do a gradual correction with an external fixator. So it's basically a brace put on the outside of your body where you'll change it over time and it will correct the alignment of your bones. But if you're an adolescent, then you have to have a surgical procedure. So the first one is hemiepiphysiodesis. So it's a plate with 2 screws. So with that being said, the screw, the side that has the plates, it will basically just keep it in that area. And since the other 2 screws are kind of far apart, the bone will grow on that side more to kind of level it out. And then there's also proximal tibial osteotomy with an external fixator, but that's just basically the same thing, but we're actually putting a physical piece in there that time, and it's not just the bone growing. So next we have slip capital femoral epiphysis, or SCFE. It's basically what happens is the hip is a ball in a socket. So when the ball or the head of your femur slips off in a backward direction, it causes a weakness in the growth plate, and then you have, you can see it right here, how it's broken off. And so normally you're gonna have this straight alignment, but when you have a SCFE, it's gonna just be, the angle is just gonna be completely off. And some risk factors for that are obesity. It happens in males a lot. and it's also common among our Black, Hispanic, and Pacific Islander communities. So, guys, don't be when I Just Wanna Rock comes on, don't get too crazy, okay? Um, so there's one treatment option for Skiffy, and that's to use a percutaneous pin fixation. You can do it with either 1 or 2 screws. So you see it right here. And if untreated, it can lead to femoral head necrosis. So basically, this medial femoral circumflex artery is going to be affected, and it's not going to be able to give blood to the hip. So now you guys are going to be the doctors, right? All right, so we have a 17-year-old male. His BMI is 56 kilograms per meter squared. On physical exam, you notice he has a genu-varum deformity. An attending asks a group of medical students, how do you think we should treat this patient? One of your fellow colleagues says that you should treat the patient with a gradual correction with the external fixator. Do you think your colleague is correct? Okay, nice job, y'all. All right. Y'all paying attention to me. So what are you guys gonna do instead? Surgery. Got it. Okay, look at y'all, future orthopedic surgeons. Love to see it. All right, second case. So we have a 14-year-old male, BMI is 28 kilograms per meter squared, experiencing right hip pain for a month. On physical exam, he experiences severe pain in his right hip, but not his left. What would be your diagnosis for this patient? Okay, Skippy, let's go. Okay, and how would you treat this patient? Hmm? How are we fixing this patient, guys? How are we fixing this patient? With the pins, right? Okay. And that's my presentation. You guys did a great job. If you want, you can follow my journey on Instagram. That's my QR code. It has my email address. If you want to ask me any questions, it has my TikTok, my Instagram. Follow my journey, support me. And you guys are going to be great future leaders of your communities.
So we have a couple minutes for questions. Are there any questions from the students? Okay. I'm sorry? For the first presentation? Yeah, we can do that. Just what school are you with? Okay, I will send it to your teachers. Okay, so maybe I'll do that. I'll send the copies of the slides to the teachers. Other questions? Go ahead. Do you like your job?
Not do I like my job. I'm in school, chill. But I'm a medical student. I'm in my second year, but I do enjoy it. Yes. It's okay. Take your time. Take your time. Medical school. So, to go to medical school, you have to get a 4-year bachelor's degree. It can be in any major of your choice, but you'll have to do certain prerequisite courses. So basic science, so biology, chemistry, physics, stuff like that. But like when you speak with your advisor, they'll plan all of that out for you. And then after you graduate, you have to take, well, it's not after you graduate. It was after I graduated. But if you decide that you want to become a doctor, during your junior year that summer, you can take the medical college admissions test, and then you apply to medical school your senior year. And then yeah, it's a process. It's a process. It's a process. Anybody else have any more questions? For the MCAT on the first try or the fifth try? What are we asking? All the tries, all the tries. Okay, so the first time I got a 492. And then on my last try, I got a 502. Excuse me? Yeah, so the program that I did was Drexel's Pathway to Medical School. So their program is geared towards increasing diversity in medicine. So it was for people who their GPA was low or they didn't have the MCAT score that they needed. And so to get accepted into that program, you had to have at least a 494 ish, something like that. And you had to get a 499 on the MCAT before the program was over. So yeah. And then I got my 502 and I got in. Yeah. GPA. It varies. I feel like I know people who did the program that I did and they didn't have like a 3.9. Like I had a 3.3. So there's other people that had like 2.9 science GPAs and stuff like that. So I just think that just do your best. Because honestly, like you're going to get interviewed for medical school. So if you're able to show your passion through the interview as well, like they'll see that you're passionate about it. You pretty much take it, it's in college. So you pretty much take it whenever you're finished with your prerequisites. But that's usually around like junior year of college. So basically, for first year, Drexel is different. So we do everything normal first. So we learn about all the body and everything normal. And then for second year, right now, which is what I'm in, we do everything abnormal. So you're pretty much learning about everything in the body. And then next year, I'm going to be going on my clinical rotations. So I'll actually be in the hospital applying the knowledge. And then fourth year, I then apply to residency programs. Ooh, that's a good question. I I don't know. I honestly just always wanted to be a doctor. Like, you know, when you go to school when you're younger and it's just like, okay, like career day, what do you want to do? Um, so I just always picked a doctor. But in terms of why I want to do orthopedic surgery, I actually was born with, I don't have like the trochlear groove. So it's a groove that your kneecap sits in. Mine is flat. So my kneecaps used to dislocate all the time. And one morning, I was 20 at the time, and I woke up and I couldn't straighten my leg, and we went to the hospital, and the doctor was like, "I've never seen anything like this before." And then he said, "Oh, we're gonna send you to NYU in the city," and I went there, and then they were like, "Oh, this is easy, we'll fix it." And that was the first doctor that I felt, number one, encouraged me to even become a doctor, because he was like, "Oh yeah, Michelle, like of course you can do this, like it's not a big deal." And then also just it's just something personal to me at that point. And so yeah, I feel like I could really, relate to my patients with that. But thank you for asking that. um Anybody, any more questions? Okay, all right, thank you guys.
All right, so our next presentation, I'm actually very proud and happy to present the next talk, which is called The Power of Esperanza. So these are three of our students here at Esperanza College. So I'm going to let them introduce themselves, but I hope that you enjoyed this presentation. That's advanced. Huh? Yeah. You don't have to stand up.
Can I put this in? Or should I? Since it's okay. We start? Right. Hello? Yep, this thing is on. Good morning, everybody. My name is Mateo Guzman.
I'm Axel Castillo.
And I'm Angeliani Torres, and we are Esperanza students.
Click. My experiences at Esperanza have been astonishing. And in part of that is thanks to the homey campus and the close community. I never feel out of place, and I never ever feel like a stranger. The professors are also very nice and very engaging, and they're always there to make sure that I don't miss a beat when it comes to learning and when it comes to class. They've always been there for me in my times of need. All of this envelops to create great experiences and offer me amazing opportunities that would allow me to give back to the community. Opportunities that my friends are going to tell you more about in a little bit. But in essence, joining Esperanza as an early college student has allowed me to grow not just as a student, but also as an individual.
Now, one of the innovative clubs that can be found at at Esperanza College is HOSA. Now, is anyone here a part of HOSA at your school? Hey, okay. So for those that don't know, HOSA is a student-led organization which gives a rising medical professionals the chance to further indulge themselves into their medical career. And so as you can see here, these are some pictures of us. It's our HOSA club from last semester. And we organize lots of fundraisers throughout the year, and these fundraisers give us opportunity to reach our goals of going to the state leadership conference. And we placed top 3, which allowed us to go further into our international leadership conference with the help of Esperanza College. We were able to go to Dallas, Texas, which is an amazing opportunity, which allowed us to learn lots of crucial life skills and skills that we will take further into our medical careers and for the rest of our life.
Another club here we have here in the college is the Champions of Hope, where students from both the academy and the college come together and work as a group to address and prevent diabetes in our community. In this club, we also visit we volunteer at the prison orchard, and we harvest crops to give back to the community. We are also currently developing a local community garden where we cultivate crops to incorporate into our community a more organic and nutritious source. We also we help in a lot of health fairs to educate our community in regards to diabetes.
One invaluable course that we take here in the college is called Engagement in the Sciences. It was a very worthwhile experience that my friends and I took to enhance our knowledge and sharpen our lab skills by using real-world lab experiments. A part of the course is also the combination of technology and public health. This is where we learned how to create 3D printable models that would help people with diabetes better go through their daily lives. It took some time to learn, but we all got there eventually.
During the Engagement in the Sciences course, which I took as a dual enrollment student, my 3D printing component challenged me to create a prosthetic 3D prosthetic leg cushion to help a diabetes patient in my community. This project inspired me to apply, and with the nomination of Professor Graciani, to the NOVA's first Future Scientist Summer Camp. In this summer camp, I traveled to Denmark and Copenhagen, Denmark, where I enhanced my academic knowledge and scientific skills. I also made friendships that I would not trade for the world, and gained motivational experiences, and valuable assets to last a lifetime.
Thank you guys so much for coming. This is the power of Esperanza through us.
We got ahead of ourselves.
Yeah, but actually, one more. Can you take a picture? Yeah, that's here over there. Okay. All right. Do we have any questions for Axel, Mateo, or Angie?
Thank you.
Go ahead.
Yes, you. We're all 17.
All 17.
We're all 17.
Damn.
So the three of them are part of our early college program where they can attend full time at the college as while they're still high school students, basically, but they don't, they're all full time college students. So that's why they're part of the college. Other questions?
I don't know this.
How much is scholarship? The scholarship.
So Esperanza offers, we have different opportunities. As Dean Marsh mentioned at the beginning of the program, all students that attend Esperanza receive a 50% tuition Esperanza grant, which is 50% of the tuition off. So to that you add if you qualify for federal aid and state aid and everything else and student loans. Many of our students do not have any out-of-pocket expense on top of their, just their loans, not anything else that they have to pay out of pocket. But also we do have, I'll talk about other opportunities in just a couple minutes. We do sometimes offer the dual enrollment course, the engagement in the sciences class that they talked about. Angeliani took as a dual enrollment course, and that was actually thanks to a grant from GSK. We were able to offer that free of cost to students. So our dual enrollment students, when they come here to take classes, there's no cost to the student for those classes. So those are things that if you're interested, we can talk about because you could come and take. And some of you, anyone here or maybe upstairs in the Grand Salon, I know you're there, I don't see you, but you see me. Raise your hand if you've taken any dual enrollment classes here at Esperanza College. So we have a few here, and I'm sure that probably we have some upstairs as well. So there are opportunities. Okay, any other questions?
Me personally, I wanted to become a cytotechnologist, maybe become a lab technician of sorts.
I want to grow up to be a pediatrician.
And I will further study to become a forensic anthropologist.
Any more questions? Oh, okay. Yes, I love it very much. It's,
We're not just saying that to say that I actually do really like it here.
sorry, can you repeat that? Oh, so we're actually from the academy. We're from Esperanza Academy, and we were offered the opportunity to come here and study full time. So we're still technically like Esperanza Academy students. However, we're full time here at the college. And ever since I made that decision, all three of us, we can probably say that this has been an amazing experience, and it's something that I would love others to share as well.
All right. So as we've been running late, I know I've seen some students getting up to go outside, probably to the bathroom. We did have a 15-minute schedule break, but in the interest of time, since we're running late, instead of dismissing you for 15 minutes, what I would like for all of you to do is to get up and let's just stretch, and we will probably continue. There's only a short presentation and then another longer presentation. So. Okay, and all right. So let's have a seat, please, so that we can get started. All right. So I wanted to point out, I think Angie was very humble when she talked about her trip to Denmark. We do have that trip was, as she mentioned, a part of Novo Nordisk celebration of their 100th anniversary. And we have some representation here from Novo. One of our speakers, the next speaker, is from Novo, as well as Dana, who actually went on the trip with Angie. And this program, there were only 100 students that participated in this program worldwide. So there were students from all over the world and only 3 students from the United States. So it was actually a really big deal that, that Angie was able to participate in this. So we're very proud of her. All right. So I will be talking about the challenge that we have right now, correct? Because the challenge is on, and all of you for being here, you're being part of that challenge. And at the end of the day today, I really want to make sure that you're inspired and that you're energetic about all the difference that you can make. So let's talk, if we're celebrating Hispanic Heritage Month. So let's talk a little bit about the past. There's some contributions that Hispanics had made in the field of medicine. So some famous people include Dr. Carlos Finlay from Cuba, who was the first one to realize that mosquitoes were transmitting the yellow fever in Cuba. This happened many years ago in the late 1800s. And of course, this was a very important discovery because then they were able to protect the community against the mosquitoes and therefore the yellow fever. Dr. Antonia Novello is from Puerto Rico, and she was actually the first woman and the first Hispanic to become the U.S. Surgeon General. This was in the early 1990s. Okay, so from Argentina, we have 3 famous people. Dr. Bernardo Alberto Jose won a Nobel Prize in Chemistry in 1947, and that was because of his, he studied the role of the pituitary hormones in the regulation of blood sugar. René Favaloro was the first surgeon to perform coronary bypass surgery in 1967. Luis Federico Lelore also won a Nobel Prize in chemistry in 1970 to study how carbohydrates convert energy in the body. And another Argentinian is Cesar Milstein, who won a Nobel Prize this time in medicine in 1984 for developing a new way to produce monoclonal antibodies. And of course, all of this technology has continued to grow, and many of the advances that we have right now, for example, when you look at things like the COVID vaccine, the mRNA techniques, and all of that, these discoveries were very important. From Mexico, we have Luis Miramontes. He worked in the synthesis of the contraceptive pill, and this was in the mid-1900s. Whoops, sorry. From Venezuela, we also have three famous collaborators. Humberto Fernandez, who invented the diamond scalpel, so very important in surgery. Baruch Benacerraf was also a Nobel Prize in medicine, so you can see that there's many that have won Nobel Prizes. He discovered the immune response the immune response genes that determine if a transplant organ will be rejected or accepted by the transplant recipient. And Dr. Jacinto Convet was nominated for a Nobel Prize because of his involvement in the development of the vaccine for leprosy. From Colombia, we have Dr. Manuel Patorroyo, who developed the first synthetic vaccine for malaria. It's not in use right now, or it's inactive right now, but he was the one that developed that vaccine. And Severo Ochoa is from Spain. So he won the Nobel Prize in Physiology or Medicine in 1959. And this is because of his work in discovering the enzymes that enable the synthesis of RNA. Now, again, that's the past, correct? Very famous people, they made it all the way through. Now, how about the present? You heard from two of our speakers already. There's another speaker coming after me. And you can see how they're already making a contribution, correct? And how they've made a contribution and how they're making a difference in the community and those that they're serving. So in the health field, we have minorities, including African American, Hispanics, Native Americans. We make up more than 1/3 of the US population. However, about 13% of physicians represent these groups, okay? And we're lucky to have some of them here, so that's great. At the beginning of the decade, there were roughly 3,000 Latino patients for each Latino doctor. Okay, so again, 3,000 Latino patients for each Latino doctor. Of course, there can be issues of language, but also cultural differences that can affect the patient's care. So if someone that's Latino wants to see a Latino doctor and they're one of 3,000, it's going to be very difficult for them to be able to see a doctor. So there is a need for a more diverse workforce in healthcare. And again, even though I'm talking a lot about Latinos because we're celebrating Hispanic Heritage Month, this happens with the other minority groups as well. So it's important to create a more diverse workforce to better serve the patient population. And actually, the NIH, the National Institutes of Health, would like to promote diversity in biomedical, behavioral, clinical, and social sciences research. So how many of you have heard the term health disparities of the students? Okay. So there are differences that exist between groups in terms of reaching their full health potential. And part of these differences may be caused by what's called health inequity. The Hispanic and Latino population here in North Philadelphia, for example, has the highest rate of diabetes. So we've been involved in a project working with, trying to prevent diabetes for the last 2.5 years. And it's because of this large number of Latinos affected here in North Philadelphia. So again, we heard some of our presenters already talk about how they're making a difference and how they plan to continue making a difference. But how about you? You're all young. You can make a difference. You're the future, correct? And the present, I would say. You also heard from our students here at Esperanza that just presented how they are making a difference. So you don't have to think, oh, I have to wait until I grow up to be able to do this or to do that. So maybe your trajectory, you heard from both earlier, the first two speakers, that they've gone different places and they've been making a difference in each one of those stages. You don't have to wait until you get to your destination to feel, oh, that's when I'll be able to make a difference. So some of the things that the youth are doing here at Esperanza include the Champions of Hope, and Angie mentioned this earlier. This is our program, Champions of Hope, Latinos Preventing Diabetes. We have a diabetes club that meets weekly and is open to students at high school level as well as college level. And some of the things that we've done, we've had speakers come out to talk with the students. We've had some Zoom speakers come in to talk with the students. We've had fun things like just, having I don't think that, okay, here. So having a cooking demo for the students to learn how to eat healthier. I know there's some upstairs that were part of that. I saw you this morning. Again, we have here some of this. This was actually an occasion that we had a nutritionist. It's hard to see it in the slide, but she did a presentation about nutrition, and through Zoom. The students also were able to take a CPR course. They were part of this summer internship program, so these activities were actually during the internship program in the summer. They were involved in developing the Diabody app, which encourages people to have healthier lifestyles. They actually, one of the students designed all of the characters here. We were involved some of the things, some of the students helped writing articles for our community newspaper called Impacto. And they also were involved in health fairs. We had community days. And then also this summer, we talked, I wanted to point out this. For this health fair, the students actually, we had gone to the orchard to gather some or harvest some of the produce, and then we were able to give that to the community. And then again, these are students giving information at a health fair. This is also a health fair. But this summer, we were involved in a diabetes advocacy program. This is with one of the other partners from the Cities Changing Diabetes program, which is what Champions of Hope is a part of. So the students were in a program called Activate. So here you have some of the other activities that they've done: preparing educational materials, working in the orchard. We've done fitness challenges, how many steps they do. We've had yoga classes and a variety of activities. And as I mentioned, this is open to high school students as well as college students. And of course, it's something that's free. It's after school. So if anyone wants to become a Diabody or part of the diabetes club, you're invited to do that. Then also, again, Angie did mention the engagement in the sciences course. It is a 3-credit course, and thanks to a grant, we're able to provide that free of cost to the students. So the students apply, and then once they're selected, we were able to offer 32 students the opportunity last year to come in and take that class. We're not offering it this semester, but we will hopefully offer it in the spring. The students did learn laboratory techniques, wet lab skills. They also learn how to do experimental research, and then they use technology, including the 3D printer, to print their designs. So this is our spring cohort, and this was our fall cohort from last year. This is, of course, doing the lab work with fruit flies. And then here, this is using the virtual dissection table and the 3D printer. This was the final presentation, because we feel that that's one of the things that really helps a student, is having to stand in front of a group and presenting their work. Okay. So the future is you. I gave you some examples of some of the things that we offer, opportunities that we offer, but I'm sure that you're also exposed to other opportunities as well. You can do a lot. Don't ever feel that you have too little to offer. You always have a lot to offer. So take advantage of those opportunities that are presented to you. Always listen to, you are going to hear a lot of things, some good, some bad. Always listen to the people that are telling you you can do it, okay? Believe in yourself, continue your academic career. If you're interested in the health sciences, some careers are shorter, some are longer, but you just take one step at a time. Follow your dreams. That's the most important one. And then believe in yourself. If you do that, you will become unstoppable. Okay? Thank you. All right. So are there any questions? I know a few of you did come in earlier to ask me questions. So I will be around if you want, your teachers have my information if you need that. Also, I will, in the afternoon, if you see me, I can give you my card if you need my information. I'm sorry? Oh, I thought someone had a question. Okay. So I will go ahead then and introduce our last speaker. Sil Patel is PharmD. So she's a registered pharmacist and a medical science liaison with Novo Nordisk, covering the state of Pennsylvania. She has been in the cardiometabolic space. So cardiometabolic, we've been talking about metabolic diseases, obesity, hypertension, diabetes. So she's been in that space for over 5 years. Currently supporting obesity medical affairs, Sil completed her doctorate degree in pharmacy at the University of the Sciences here in Philadelphia. And following that, she completed a 2-year postdoctoral practice fellowship at Novo Nordisk. Welcome, Sil.
Thank you so much for the kind introduction. Can everyone hear me okay? Okay, perfect. I think this is a little jiggly, so hopefully it doesn't fall on me. But good morning again, everyone. I know I'm standing in between everyone and lunch, so hopefully I'll keep this short and sweet. And we've had such inspiring speakers so far, so definitely feeling motivated to, even in my current role, to go back and do whatever I can. So looking forward to sharing a little bit more about the role of a pharmacist with you all today. Does anyone know your local pharmacist? Do you have a pharmacist that you go to? Maybe raise your hand. Yeah, awesome. So hopefully I can shed some light about some of the career opportunities with pharmacists today. Okay, so I'll start off with a little bit around me and my academic path and what kind of led me to pharmacy, and then a little bit about obesity as well, because it's such a large part of what I'm doing in my current role. So I'll touch on that a little bit as well. Okay, so a little bit about me. Again, my name is Zil. I am a first-generation Indian American. So my parents immigrated from India in the 1980s, and I grew up in a multi-generational home, meaning I grew up with my grandparents living with us and my parents and my brother. And my earliest memories include going to doctor's appointments with my grandparents who didn't speak English, and so I was often the translator going back and forth and translating for them. And I remember being maybe 6 or 7 and feeling very important, like I had a role, and being able to be that middle person between the doctor or the nurse and my grandparents. So that was my very first exposure to healthcare, and I loved it. I loved going to the doctors. I loved going to the pharmacy with my grandparents to pick up their medications, and knew I wanted to do something related to that. What it was, I wasn't exactly sure. I also spent a lot of time with my grandmother very early on, and she's really instilled in me a love of cooking and a healthy lifestyle. She was very active and very excited about trying new recipes and, making them healthy. And so it just, that was also kind of mixed into my very early childhood. And so that kind of helped to, promote my interest within chronic diseases and diabetes and obesity as well. So I grew up not too far from here in Bucks County and in Bensalem, Pennsylvania, and have been in Pennsylvania my whole life, not too far from Philadelphia. So my academic path, I'm not sure how familiar everyone is. We talked a little bit about, nursing and the path there, as well as, medicine, and, pharmacy is also another option within the healthcare space. And so my path might be a little bit different, but traditionally, and I'll talk about it a little bit more in a few slides, but a pharmacist typically has an undergrad degree, so a bachelor's degree in science. It could be anything really, but just you need to have the prerequisites within science, so biology, chemistry classes, and you need to take the PCAT afterwards, or there's some programs that are direct entry and will let you admit directly from high school into a 6-year program, which is what I did. So I went to school in West Philadelphia, not too far from here at the University of the Sciences, and it's now called St. Joe's. You might have heard that, but I got my bachelor's degree from there, but it was a combined dual degree program. So within 6 years, and it's helpful because you get to save on 2 years of schooling. There's a lot of accelerated programs within pharmacy as well. And so I did that. After 2 years of undergrad, I did 4 years of pharmacy school. And so after that, you get a PharmD as well as a bachelor's degree in this accelerated program. So at that point, kind of going back to my early exposure within healthcare, one of the key people that really motivated me, and I still keep in touch with her to this day, is the pharmacist that would fill the prescriptions for my grandparents. And she was always just so willing to take the time out. The doctor's office didn't always have the time to explain what their blood pressure medication was for, how to take their insulin, or what does that mean? Why are they on it? Why should they be on it? So she would always take the time to explain everything, and just check in when they weren't coming in to fill their prescriptions. And following high school, I ended up working at the pharmacy with her, and was really just inspired by the impact that she had on our community. And believe it or not, pharmacists are actually some of the most accessible healthcare providers in the country. So basically, every corner has a drugstore, and within the drugstore, there's a pharmacist. And oftentimes it's just people forget that they're there, and they're a good resource within the community. So following that, entering pharmacy school, I always thought I wanted to go and become a community pharmacist, like the one that was helping my grandparents. And during pharmacy school, the last year is what we called APPES, and it's basically a rotational 1-year exposure to different areas within pharmacy. So community pharmacy, hospital pharmacy, and then there's a unique path, and it's called industry pharmacy. And so I spent some time at Johnson & Johnson, which is a pharmaceutical company, and was really just amazed by the opportunities that you had as a pharmacist to do so many different things, from marketing to medical to, there were some pharmacists in what's called regulatory affairs, which is associated with how do you get drugs approved and working with the FDA, or the Food and Drug Administration. So I was just blown away by the opportunity to do multiple things. And I'm the type of person that gets bored very quickly. So what else could I do? So, that facet was very just interesting to me. And so post-pharmacy school, I did a 2-year fellowship with Novo Nordisk. And so a little bit about the company. It is a chronic disease company. And so there's other areas that we focus on, but they're typically known for diabetes and obesity. And so this was, again, just from my early exposures with my grandparents, something that they faced. And so it was an interest of mine. And so I ended up doing a 2-year medical affairs fellowship with Novo Nordisk, and have stayed with the company ever since. And currently I'm doing my MBA at Villanova. And so again, just kind of trying to see what else is out there. And now being in the industry space, learning a little bit more about the business side of things, which I don't have any knowledge about whatsoever. Haven't taken, most of my classes have been around pharmacy or chemistry or science related. So just something new from my perspective. So I'm doing that currently. So the reason I'm here to talk to you is not just about obesity, not just about pharmacy as a career path, which I hope some of you will consider if you're not too familiar with it. And I'm happy to chat about that as well, but obesity as a disease. And so we've talked a little bit about diabetes, and one of our speakers talked about obesity and how it impacts orthopedics and that area as well. But I wanted to touch a little bit on obesity as a disease. So just by raise of hands, how many people in the audience think that obesity is a disease? Yeah, so I'm seeing a lot of hands. So I'm going to say most of the audience agrees that it is a disease, but it's actually quite complex. And before I was in this role, I had no idea that obesity was this complex. I didn't learn about it in pharmacy school, and I almost guarantee you that the other speakers didn't really learn a ton about obesity as a disease within medical school or nursing school. And so I think there's a lot of unknowns in this area, and how do we address it as a disease and not just something that's associated with your lifestyle or associated with your diabetes or your high blood pressure. So it's actually quite complex, like this slide shows, and it's associated with over 200 conditions, from diabetes to high blood pressure to arthritis and joint issues, as well as several different types of cancers as well. So just goes to show how important it is to treat obesity early on to prevent a lot of these complications later. And I won't go into the exact pathways, but your appetite, which controls hunger and how much you eat, it has to deal with the hypothalamus area of your brain, which controls, when you feel hungry or when you feel full. And basically, in the disease of obesity, patients have an imbalance in the hormones that regulate hunger. So you might have heard when you go to the doctors, or you might have heard someone just give the advice of, why don't you just eat less or exercise more? And we're just learning more and more about obesity as a disease, and we're learning that it's not just willpower, right? There's a lot of other factors that are associated with obesity, because I am sure a lot of people in this audience have family members, or they themselves have tried to lose weight, but it's not easy, right? Because there is something called metabolic adaptation, which is basically a set point. So when you're trying to lose weight, your body is doing everything it can to go back to that normal set point, which is what your body determines as, this is the right spot and we need to get back to it. So even though you might be doing all the right things, it's just hard for patients to maintain their weight once they lose it. And so again, that's why it's really important to treat it as a disease. And a lot of the interventions act on some of these pathways that help to treat obesity as a chronic disease. So obesity stigma and bias is very real, right? And so there's one thing that I want you to take away from this presentation is just being mindful of how we're approaching obesity and people living with obesity within our day-to-day lives, right? So one piece is that obesity isn't really taught within medical schools and nursing schools and pharmacy schools and other healthcare professions programs. So I think it's a big gap in terms of how do we talk to a patient with obesity, and how do you talk to a family member or a friend living with overweight or obesity. And so some simple things that we can do include using patient-first language. So you don't say this patient is diabetic, or you don't say you use patient-first language. So it's a patient living with diabetes or a patient living with overweight or obesity. So these are just some simple things that we can do to be mindful of how we're talking about patients living with this disease. And then avoiding stigmatizing words like fat, morbidly obese, that's really can discourage people from just wanting to get the appropriate treatment as well. And so just being mindful of how we're approaching patients with obesity. And like I mentioned, obesity is caused by a variety of things, right? It's not just patients are eating right or they're not exercising, but there's a huge genetic component of obesity. And so, that part is a little bit harder when it comes to treating it as well. Some patients are just more prone to having overweight or obesity. Some environments can also promote overweight or obesity depending on where you live or what foods you have access to. There's certain medications that cause overweight or obesity. So again, a lot of complicating factors. It's not just about what you're eating or how much you're exercising. So we touched a little bit on this as well in the previous presentation, and it seems like a lot of you are familiar with social determinants of health and health inequities, but this piece is also huge. We just saw the statistic that Philadelphia has over 20% incidence of type 2 diabetes within the Hispanic community, and so again, it's there's a lot of other factors beyond just your lifestyle that come into play when we're talking about overweight or obesity, and so simple things like certain races are more prone to overweight or obesity. We know patients of color or Hispanic patients are more prone to be suffering with overweight or obesity. Also, education level. It's linked that patients with lower education levels are living in poverty or more likely to experience overweight or obesity. So, even as a pharmacist or even as a nurse or a doctor in the community, it's important to be mindful of not just recommending that patients eat healthier, but really kind of getting into where do they live? Do they have access to healthy foods? There is something called a food desert. And what that means basically is that, within a certain geographic area, there's not a lot of access to healthy foods. And so you might not have a grocery store with fresh fruits and vegetables. It might be easier to, get food at McDonald's versus prep, a salad or something healthier. So again, a lot of environmental factors that go into obesity as well, otherwise known as the social determinants of health as well. So we talked a lot about, one being a pharmacist in my path, obesity, and then how exactly do you treat obesity? It's a disease. I'm saying it's a disease. Most people here are raising their hand and they're agreeing it's a disease. So how do you treat it? So here on the slide, you can see multiple ways of treating it. So the biggest bubble and the most important, regardless of your BMI or your body mass index, which is how they measure obesity, is lifestyle interventions. So that healthy living, exercising, eating healthy is so important, regardless of any chronic condition like diabetes or obesity, but obesity especially. And so depending on your BMI, which is your body mass index, some patients might need to take medicine for their overweight or obesity. And so if you're at a BMI of above 30, then patients should consider medicine. There's also bariatric surgery for those patients who are at the higher BMI cutoff. So again, just a lot of things to think through when you're treating obesity. So it's not just exercise and it's not just eating healthier, but there's other interventions like intensive lifestyle therapy. There's medications, there's surgery. So again, just a lot of other options for treating obesity besides just diet and exercise. So going back to, and I'll tie it all together because you're probably thinking, what does obesity have to do with, being a pharmacist? And so a large part of my role is around obesity. So before I talk about my current role, does anyone have any ideas about what a pharmacist does? What is their role within their community? I see some hands. Yeah, I hear they give out medications. Yes, so I went to the next slide, drug development as well. They can be involved with that. So I'm gonna mix some slides around, but basically a pharmacist is a healthcare provider within the community that is involved in the preparation, the dispensing of drugs, or other medicinal products within a pharmacy setting. So a lot of people are familiar with their pharmacists at CVS or Rite Aid or at Walgreens, but pharmacists work in so many different areas. And I think it's really one of the more diverse career options as within healthcare that you can do so much as a pharmacist. So there's pharmacists who work in the hospital setting and they specialize in diseases like infectious diseases or oncology, and they provide recommendations to the medical team around that area. You can also work within managed care, so you can work within a health plan and try to figure out which medications should be covered within a health plan and for what reason, and some of the cost factors behind it. So again, there's a variety of places that pharmacists can work. One of the less well-known paths for a pharmacist is the path that I took, which is becoming an industry pharmacist. And so when I say industry pharmacist, I'm referring to a pharmacist that works within a pharmaceutical company or a biotechnology company that's involved in drug development or supporting a company from that perspective. And so if you think about that, they have a larger, not so much a direct patient-to-patient impact, but more so on a broader scale. And so I kind of mentioned a little bit about what it takes to becoming a pharmacist. There's a lot of accelerated pathways that allow you to do it within 6 years. So they combine 2 years of undergrad with 4 years of pharmacy school. Some people will do the 4 years of undergrad, get a bachelor's degree, and then apply to pharmacy school. Some people will do different things, right? So they might go and do an undergrad degree in something totally unrelated to science, and then they can take their PCAT, which is the pharmacy school admissions test, and then enter pharmacy. So a lot of different routes to becoming a pharmacist. So what exactly do I do as a medical science liaison, as a pharmacist working in obesity, putting it all together? So basically, in a nutshell, a medical science liaison is kind of what it sounds like. You are a liaison between the company and the science community. So most of what I do is around the obesity space. And so I get to speak to different experts, and we call them thought leaders and researchers specifically within obesity, and learn from them and figure out, what areas are we missing when it comes to treating obesity, and then bring them back to the company, which then takes these insights and helps them to make decisions around the drug and how to move forward within this area. And so again, pharmacists are uniquely positioned to support this kind of role because they have a large and extensive amount of training in pharmacology. So they understand how drugs are working. They understand the diseases. They understand how to communicate the science both to patients, because pharmacists are dealing with patients day to day, but they're also dealing and communicating with healthcare providers, so they can speak that language also. So they're very good communicators. They understand the science, and I think this is why the pharmacists have a unique skill set to becoming a medical science liaison. So some of the other things that I also do is I support research, so working with external universities and researchers to partner on different research opportunities within obesity, as well as diabetes. I attend different conferences for obesity and diabetes, and basically act like a sponge and learn all of the new data to make sure that I can keep up when I speak to these external experts and researchers around the disease. So basically, in a nutshell, as a medical liaison, my role is to learn and stay on top of the new data that's coming out in this space, to communicate with the researchers and experts in the area. And one of the unique things that I do as an obesity medical liaison is supporting education around obesity as a disease. And so I work with a lot of different medical schools and nursing schools and pharmacy schools to implement more of that obesity education within these programs, to make sure that tomorrow's generation of healthcare providers are receiving that education. So they can treat their patients more holistically. They're using and being mindful of some of the stigma and biases around obesity. So that's probably one of my favorite parts of this job, is working with these different programs and schools to make sure obesity is implemented and part of their training program. And that is about it. So I'll end there. I'm happy to take any questions.
Are there any questions? All right. Well, let's thank Dr. Patel again for her presentation. Thank you. And all the presenters this morning. So we will be moving, but I need a couple things. So all the students should have a drawstring bag that you received when you checked in this morning, correct? Everyone has it, very good. Inside that bag, you have a disposable lab coat. You also have goggles. Those are for you for the later part of the symposium today. We will be moving to, then your badge will tell you also, that's very important, your badge on the back will tell you where you have to go. So the next part is going to be the panels. And for the panels, you will stay with your school. Some of your schools may be in 2 different classrooms, but you will be nearby. I would ask if please students from, and let me finish before you start moving, but I would like to dismiss first students from Swenson High School and students from Sayre High School that are here. You will walk back. You have to go upstairs with your, you should be here with your ambassador, and you will go back to, you'll go up to the 3rd floor. You will not, you're going to pass a lunch station, but you're not going to grab your lunch there. They'll indicate to you where you have to get your lunch. It will be right in the space where you're going to go for your panel. So if everyone lets the students from Swenson and Sayre leave first, I would really appreciate that. Now, everyone else from other schools that are not Swenson and not Sayre, as you walk out you have to walk out this way. Yeah. Yeah. Where you checked in this morning, that's where your lunch will be. And then upstairs, I'm sure that they're receiving instructions for lunch. Thank you, everyone. All right, so again, all the other schools, when you walk back in the same space where you did the check-in, there'll be some tables there with lunches. You can grab your lunch, and then you will go up to the 3rd floor for your panels. Okay, and your ambassadors will help you. And if the speakers can please stay, I would like to get some pictures. Okay, thank you. So the other schools can head out now. Qué bueno. Déjame ver si, no sé dónde está. Okay. Yo creo que no la tengo aquí. Okay. Robert, can you put the slide that says minority? Es para poder sacarnos una